repeat the question the best my ability. So Cam wanted to know about the current number of doses that we've done, the gap between the doses that have been distributed, and then what does this mean for working towards 25,000 doses a day? Is that about?
When are you going to fix that discrepancy? You say that there's unreported numbers on the website. How is that fix coming
Yeah.
along? And then when are we going to get to that wall of supply?
Right. Okay, so currently, today's data shows that we're right at about 400,000 doses administered out of a total of 960,000 doses distributed. Now, the distributions come at the beginning of the week, so they're shipped generally on Tuesdays. And so there's a certain amount of vaccine that is just going to be the Delta, right? So this week, it was 105,000 first doses and 61,000 second doses. So that's 166,000 doses that will get administered at events like this across the Commonwealth over the course of the week. And so we'll see those numbers come in. So you take that 166,000 out. Another big chunk of that vaccine has been earmarked for the federal pharmacy partnership. So the federal government's strategy to prioritize the vaccination of all residents and staff of long-term care facilities. So nursing homes, assisted living facilities, group homes, independent living, was to contract CVS and Walgreens. And so of the doses that we are getting, about 226,000 of those are earmarked for CVS and Walgreens. They are working through those facilities. Many of the skilled nursing facilities have either already been completed or will be completed by the end of January. They are working to staff up. I had a conversation with their state leadership this week. I know other leaders in our state government also did. And so we're really trying to figure out what do we need to do to come alongside CVS and Walgreens to get through that population more quickly. They've got the vaccine, but there are challenges with that population, right? So many of our long-term care facilities are actually experiencing active COVID outbreaks, which means we've got to put off those vaccination events by a couple weeks or until things settle down in those communities. And so that's going to stretch out our timeline a bit, but then we're also starting to look at how do we, partner with other local pharmacies that already have relationships with these facilities and potentially reallocate. So that's another chunk of the vaccine, which is how do we get through that 1A most important population as quickly as we possibly can. And then there's another chunk of the doses that have been distributed, and for various reasons, they're either in the process of being redistributed to other facilities. Some of them, I think there were certain people who received the vaccine, certain entities that were unsure about the coming of the second doses, and so they're holding those vaccines and have them scheduled for their staff's second doses now. So, and then there's about 90,000 that are actually have already been administered. But there's a data gap. Either we need to do manual entry in those cases or ensure that the systems, the registration systems that those patients were registered on and that the vaccine was given to has an appropriate link to our state database, which is where we pull out all of the data. So those are the main categories for where those doses stand now. My job is to really close that gap and make sure that we get the data quality right so that we have a much more accurate picture for Virginians about how vaccination is going here in the state.